Hello, I'm Steve Edwards, and I serve as President and CEO of Cox Health. This is an update to our employees and our community. It's being recorded on September 9th. It's also the 6-month point of this pandemic, and it's an important time, I think, for us to reflect on what we've learned, where we stand, the status right now, expressions of gratitude for our community and others who have made this more manageable, and maybe what to look for in the future. First, let me begin to talk about a little bit about an update. We have now had 500 admissions to Cox South related to COVID patients. Almost all of those, COVID was the primary reason for admission. We've had a few that may be other cases, maybe an oncology case that also had COVID as well. As a point of reflection, on July 1, we had 268 cases that we tested positive through that point in the year. We're now at 3,200, and so the prevalence has grown. The rate of increase has been exponential, like we anticipated and like we prepared for. We saw a recent record high number of inpatients with COVID at Cox South was 70 about 3 weeks ago. That number has moderated to about 50 to 55 each day, fairly steady. We think that's our first crest. We might have a second crest. We might have some waves of this, but I think it's moving into a more chronic phase of managing this disease in our community. Sadly, I report that we've had 48 deaths in our health system of patients we cared for, people that we know and love in our community, loved ones, and we've lost one of our own. And to me, there's nothing more tragic in a healthcare system to lose an employee. This is an employee that was serving patients in our clinic setting. We don't know how someone may have got the disease. It's likely it could be in the community, as the community spread in that clinic in that region was high. There was a moment in that clinic where there was a patient that had to be treated that did not have a mask on for a while, and there was a risk of exposure there. It is, in my mind, an expression of the deepest loss of any organization and a reminder to all of us that we're all vulnerable to this disease. This was a relatively young employee that we lost. It's almost unimaginable to me what we would look like if we were encountering these rates, these prevalences 6 months ago. So the time that we've been bought, because we're in the Midwest, because of actions of our leaders, have allowed us to be better prepared. And so I want to talk about some things we've learned. Early on, if you remember, we were worried about fomites. We're worried about touching surfaces. Maybe there was a package from China, maybe elevator buttons. We've learned that there's very little risk associated with a fomite or surface contact. There's more risk with droplets. We know that when we cough, when we sneeze, when we speak, when we sing, when we yell, we increase the risk of droplets being spread. And that's why mask tends to work, even imperfect masks, because they do slow down the rate of droplets. It's also very likely that aerosolized is still a risk factor. We've learned that the amount of virus you're exposed to has an impact on the likelihood of getting an infection, and the amount of virus you're exposed to has an impact on how serious the disease might become. Again, masking works for those reasons because it reduces that amount. We've learned that it's higher risk to be indoors than outdoors. Air moving helps, UV light helps. We've learned that probably the greatest risk is to be side by side or face to face, shoulder to shoulder with someone, unmasked, indoors, for 15 minutes or more. So think of meat processing plants, think of jails, think of nursing homes, think of all those situations where we might be side by side with someone for an extended period of time, especially in transportation, buses, cars, etc. We've learned that nursing homes are especially high risk because of the age of the population. And we saw early on 40% of the deaths nationwide were in nursing homes. So as we've learned to box in strategies to keep those patients safer, we are saving lives. We've learned that children are at lesser risk for infection and transmission of the disease. Hospitalization rates for children are at 8 per 100,000. For an adult, it's 164 per 100,000. And as we age, and certain minority groups and socioeconomic factors, that hospitalization rate may be as high as 800 per 100,000. So we need to be aware who's at greater risk. We need to be especially protective of those people. There's also randomness to this disease. Despite all the data we have, there are patients that get it for reasons we can't quite understand. Perhaps a difference in their DNA, or their genetic response, their immune system response. We've had patients in our hospital as young as 21 on a ventilator, and we have many patients much younger than nursing home patients that are very at high risk for this disease for hospitalization. We've also learned how to better treat these patients, and so the fatality rate's going down for that reason as well. We've learned likely that convalescent plasma, a drug called remdesivir, and dexamethasone, which we're using, seem to work together. We may never know with certainty because we don't have double-blinded, placebo-controlled studies for all that, but our physicians nationwide and locally are learning that this is appears to be helpful, and we have good supplies of these, fairly good supplies of these right now. I want to spend a moment addressing maybe expression of gratitude for our community, for leaders, for staff, for the difference they're making. Again, had we not had this time, that our community bought us by being responsible, by wearing masks, by distancing, by hand hygiene, we wouldn't have been as prepared for this. I'm especially grateful for courageous leaders like Mayor Ken McClure and our entire City Council who voted unanimously to protect our community. I'm grateful for mayors like Ed Akers and Branson, the mayor of Forsyth. We've seen Taney County incident rate peak and go down dramatically since masking. We've not seen the same result of masking. In Springfield, we saw a plateau. Then we saw a rise after masking. I think that rise is in part due to institutional numbers, due to influx of college students. And then quite frankly, Springfield is an island inside an area without masking. So Greene County, only about half the population of Greene County is under a mask mandate. So we'll never quite know the true effect because of that. I want to have expression of gratitude because of what we've been able to do due to this time. So we have a year's supply of almost every important PPE item under a surge. We would not have had that early on. We have paralytics and medications that we need to treat our patients. Our space, we were able to expand our space dramatically. So we have created a 51-bed COVID ICU unit. We looked at that as almost like a tornado shelter, something that we thought we might not need. We prayed we wouldn't need. But as it turns out, we're using it almost every day. It's a very busy unit. It also turns out it's a highly effective unit. Our staff feels safer in there. We're able to keep our patients safer, and I think we're maybe able to more immediately care for our patients with this direct oversight the way the unit's designed. We also had 24 cardiac beds this summer, private inpatient cardiac beds, and we're completing 36 additional med-surg beds that will be done this fall. That will add 111 total beds since the beginning of this to our Cox South Hospital alone. This is important because as the COVID numbers rise, also we have other patients to care for. As a matter of fact, COVID's a small percentage of the care we take care of. So we've got to take care of patients that are at risk for stroke and heart attack and for oncology issues and normal routine care. So our hospitals have been running at a census number higher than I've ever seen, but we've been running efficiently and effectively because we've been able to have time to be more prepared. I'm perhaps not grateful for any group more than our staff, whether that be someone in accounting or housekeeping or in our COVID units who are all working together to care for our community in these important ways right now. I'm especially grateful for the staff on our COVID units who are volunteers. And there's something indomitable about the will of a volunteer who does this because they want to care and serve our community, so I'm grateful for that. I'm grateful for all of our frontline healthcare people that are standing, caring for patients, whether it be in our clinics or in the hospital setting. I want to speak just a moment about the future, some worries and then some things that give us hope. First, we are concerned that while we manage COVID, that we enter the fall and winter and we might have an elevated flu and respiratory season. Every year we have elevated flu and respiratory. To layer those on top of our normal patients, on top of our COVID patients, may put healthcare systems across the country at risk again for capacity issues. The good news in this is that the summer is ending, but in the southern hemisphere, winter is ending. And we've seen what's happened in places like Australia, New Zealand, where their flu and virus loads have been very low. We think that's because of mitigating practices, safety practices, so that's really encouraging. But I also remind you, in the United States, we lead the world in deaths, we lead the world in infections, and in part because of our cultural inability to really embrace some of these important protective measures, like wearing a mask and keeping our distance and being safe. So a reminder that to get through this respiratory season, we've got to continue to be diligent about being safe and keeping our distance and hygiene and mask wearing. Vaccines are moving forward very quickly, and we're going to hear encouraging and disappointing news as it evolves. The question's been asked of me several times on our leadership team, will we require our employees to take COVID vaccination? We're not likely to be in a position to make that decision for a couple of important reasons. One is we don't yet know the efficacy. of the vaccine. We don't yet know the safety of the vaccine, although early information looks encouraging. And we also don't know the availability. And the availability alone might be that rate limiting factor, because we won't likely have enough to vaccinate everyone in our country right away, so we'll have to prioritize. We've also learned in flu season that those employees who can't get a flu shot, we mask. And we've learned that masking keeps us safe, and so for those that decide not to get the vaccine, we'll ask them to mask, and we think that will keep us safe. We are, I think, a long ways through this crisis, and I believe that by this time next year, it will be largely behind us. I hope at least, and I pray for that. First world countries will be ahead of this, then third world countries. I believe that the world will begin to get back to normal in many ways, and we'll have learned many important lessons. In the meantime, we're not through this yet. I know that we are tired of it, and it's changed our life, but this is the most important time for us to be safety-minded right now as the prevalence is high and as we're going through the flu season. So I remind you, keep your distance from each other, be safe, wear a mask, hand hygiene, and try to have grace and understanding toward each other at this important time in this disease.